Hi, do you think movie trailers have an impact on the audience? Of course, yes. They set the tone of the movie, creates interest among the viewers, and actually prepares the viewers for the story. In the same way, when it comes to OET letter writing, the purpose paragraph actually guides the reader and ensures that the reader understands the patient's case right from the start. So it's crucial that we craft the purpose paragraph rightly. Now, how do we do that? Let's find it out. Now, here I take you through a case note. This is the first part of the case note, which states what your role is and the patient's basic details, social background, past medical history. Then a few dates are given, which shows the recent happenings. Then we have the plan and the writing task. So during the reading time, where do we start our reading from? First, we understand what our role is. So we understand that we are a charge nurse at a geriatric care center. So we understand that the patient is also a resident of the geriatric care center where you are working as a charge nurse. Now, after understanding your role, then you immediately jump to the writing task to understand who the reader is and what is the purpose of writing the letter. So let's find out that. So you understand that using the information in the case notes, write a letter to the patient's neurologist. So the reader is patient's neurologist. You see this apostrophe S next to the reader, which means that this is a known case. You understand this is a known case, and the reader's name is given here, Dr. Harish Fernandez, Head of ICU, St. Vincent Hospital, Melbourne, Australia, requesting, now here they have stated the purpose or the reason for writing the letter, requesting emergency assessment and ICU admission for Mrs. Annie Benold. So we understand that we are supposed to write letter to the patient's own neurologist, requesting emergency assessment and ICU admission for the patient. So after reading or after understanding the writing tasks, what we do next is we go through the plan to get a better clarity on what exactly the reader has to do for the patient. So while going through the plan, we understand that the first point is that the patient will be transferred to the St. Vincent Hospital where this neurologist is working. And the second point given here is that the patient may require a CT scan. So we understand that something has happened with the patient. Actually, that has prompted an emergency assessment and ICU admission for the patient. Now, to understand the patient's side of the story, we scan through the case note. So this being a known case, we already identified that it is a known case. So for that reason, we need not consider the social background and the past medical history, which will already be known to the reader. So we can skip the social background and the past medical history. Now we see a date which has happened, or which is a date which is earlier in this month. We are writing the letter. Today's date is given as 28/10/2019, and this date is again from the same month, 10/10/2019. So what has happened there is the patient has visited the hospital and the patient was diagnosed with Parkinson's disease. It's given that the patient was diagnosed with Parkinson's disease. And since the reader being the patient's neurologist, this of course is known to the reader. And then other details like signs of depression and psychiatric counseling given, all those details are given. And then the next date given is 27/10/2019, which means yesterday with respect to when we are writing the letter. We are writing the letter on 28th and this is the previous day's happening. So in the previous day, the patient had exhibited worsening symptoms, or the patient's condition has deteriorated in terms of his memory loss. He had confusion, unsteady walking, a lot of happenings are seen here. And coming to today, 28/10/2019, what you can see is that the patient tried to walk upstairs without walking sticks and he had a fall from the stairs, resulting in a head injury. And what has happened after that? The patient has exhibited signs of seizure, heavy bleeding, 2 episodes of vomiting. She's unconscious, unresponsive to verbal commands. So actually this situation has prompted the requirement of emergency assessment and ICU admission. So from the story of the patient, we understand that the reason for writing the letter, or the reason why we have requested for an emergency assessment and ICU admission, is because the patient had a fall today resulting in a head injury, and following that major complications have occurred like seizure, heavy bleeding, unconsciousness, and so on. Okay, now let's look at a sample purpose paragraph which one of our students have written for this letter. Okay, now let's look at the sample letter. Now, if you read through the purpose paragraph, what can you see? I'm writing to request an emergency assessment and ICU admission for Mrs. Annie Benold. Of course, that is right. Emergency assessment and ICU admission are the requirements. And what is the reason given here? Who has been diagnosed with Parkinson's disease. Is that the reason why we are requesting emergency assessment and ICU admission? Of course not. First of all, we need to understand that when we write the purpose paragraph, we should not be inclined towards the main medical diagnosis. The main medical diagnosis might not always be the reason for writing the letter. What is the reason for writing the letter? That is purely decided by the writing task and the plan. Based on the writing task and plan, we have to decide the purpose. So here from the writing task and plan, what we understand is that the patient requires emergency assessment and ICU admission. So of course for Parkinson's disease, the patient will not require that. But what has happened today morning, that is the patient had a fall, she had a head injury and she had complications following that, which resulted in this requirement. So for that reason, this cannot be considered as the right purpose. And moreover, this Parkinson's disease is not something new to the neurologist. This neurologist, being the patient's own neurologist, the reader would already be knowing this scenario. So we have to conclude that this is not the right purpose. Now I shall show you a few variations of the right purpose paragraphs. Okay, one variation is like, I'm writing to request an emergency assessment and ICU admission for your patient, Mrs. Annie Benold. Then you have written the reason. She's experiencing severe complications following a head injury, which means that the requirement and the problem are matching or related. So this serves as the right purpose. Here you see the requirement is CT scan. Then we need emergency assessment, ICU admission. So this problem of severe complication following a head injury justifies this requirement. Now I'll show a couple of other variations as well of the purpose paragraph. Mrs. Annie Benold is being transferred to your facility for prompt assessment and ICU admission. She's experiencing severe complications following a head injury. That also conveys the same meaning. One more. This letter is with regard to Miss Annie Benold, who is experiencing severe complications secondary to a head injury. She requires urgent assessment and ICU admission. So when you look through these three different variations, what you can understand is that all of the three purpose paragraphs convey the same meaning, but it's just they have been put in different ways. Now what can we conclude from this? What are the things that we have to include in the purpose paragraph? Essentials of an ideal purpose paragraph. The first thing is that you have to mention the patient name. Of course, we have included in all the three variations, we have included the patient name, Mrs. Annie Benold. Then we have to identify the requirement of the patient from the reader. What does the reader need to provide to our patient? Now, how can we identify that? We can identify that from the writing task plus the plan. Together, we can identify what is the requirement of the patient from the reader. So in this scenario, we have identified that it is emergency assessment and ICU admission. Now, the next thing that we have to include in the purpose paragraph is that the current state, it can be a medical or a non-medical status. It need not always be the main medical diagnosis. So the current status of the patient, which is actually aligning with this requirement. Whatever current status, whatever you are stating as the problem, that should match with the requirement. Only then your purpose paragraph will be fine. So here what we have identified is that the complications secondary to head injury. Okay, so when we look through these three variations of the purpose paragraphs, in all the three variations we find that the patient name has been mentioned in all the three variations. Then the requirement of the patient from the reader, that is Emergency assessment and ICU admission has been mentioned in all the three variations. Then the current status, of course, that is fall related complications have also been mentioned. But the only thing is that they have been placed in different ways, but whatever it is, all the three variations of the purpose paragraph convey the same meaning. Now, what can we conclude? So, I would say that when you write the purpose paragraph, it needs to be concise and sharp and to the point, because it acts as a gateway to the letter. So, you need to ensure that you get into the practice of writing the purpose paragraph rightly. Keep practicing and you'll master it in no time. Hope you found this video helpful. We'll be back with more such videos, so stay tuned. Thank you.
MedCity International Academy. Trusted hands forever.